Ready for a quick but powerful pharmacology review? Because today we're going over the 5 medications groups that the Nclex absolutely loves to test again and again. And yes, if you master this, you will have already won half the exam. So if you're taking notes, grab your notebook or just listen carefully because I will give you the most important tips you need to remember about antihypertensives, anticoagulants, insulins, antibiotics, and psychotropic drugs. We will make it simple, clear, and based on clinical logic. So you don't just memorize, you actually understand why the Nclex acts what it acts. Ready? Let's start with the first one. Antihypertensives are among the Nclex favorites, and for a good reason. If administered incorrectly, patients can quickly become unstable. Here's what you must know. AC inhibitors, enalapril, like enalapril or lisinopril, they block the conversion of angiotensin 1 to angiotensin 2, lowering the blood pressure through the vasodilatation. An Nclex tip, watch for the dry cough, hyperkalemia, and angioedema. If angioedema occurs, stop the drug and notify the provider immediately. ARBs, angiotensin receptor blockers, any sartan like losartan or valsartan. Similar effect, but no dry cough. Use it when patients can tolerate AC inhibitors. Beta blockers, any LOL like metoprolol or propanolol. They decrease the heart rate and the blood pressures. Always check the heart rate and BP before giving. If heart rate is less than 60 or systolic blood pressure less than 100, hold the dose. Avoiding asthma or COPD may cause bronchoconstrictions. Calcium channel blockers like amlodipine or verapamil relax blood vessels but can cause peripheral edema, bradycardia, and hypotension. And finally, the diuretics like furosemide or thiazides also lower blood pressure but monitor for hypokalemia, orthostatic hypotension, and with furosemide, the ototoxicity. Now, let's move on to anticoagulants, another Nclex hot topic due to the bleeding risks. Heparin is a fast-acting, given IV or subcutaneous. You have to be monitoring the PTT, and it should be to 1.5 to 2.5 times normal. The antidote is the protamine sulfate. Warfarin or Coumadin is a long-term oral use. You have to be monitoring the international ratio. It has to be from 2 to 3 target range. And the antidote is the vitamin K. An Nclex tip is teaching the patients to avoid foods high in vitamin K, like spinach, broccoli, and kale. Direct oral anticoagulants like apixaban or rivaroxaban. No lab monitoring required, but safety education is a key. Using a soft toothbrush, avoid contact sports, and report bruises or initial bleeding. If there's one guaranteed topic on the Nclex, it's insulin. You must know types, timing, mixing, and hypoglycemia signs. Let's check it deeper. Rapid acting like Lispro or Humalog. Onset 15 minutes. Peak 1 hour, duration 3 hours. Always remember, 15 minutes feels like 1 hour during 3 rapid responses. Short acting. We have the regular insulin. Its onset is 30 to 60 minutes, the peak 2 to 4 hours, and duration to 6 to 8 hours. This insulin is only given IV. Intermediate. MPH. Onset 2 to 4 hours, the peak 6 to 8 hours. Looks cloudy. You just roll gently. Don't shake it. And long-acting Glargine or Lantus. No peak, the duration is 24 hours. And finally, never mix with other insulins. Nclex tips. Always check blood glucose before giving, mix in order, clear before cloudy, regular before MPH. And for hypoglycemia, give 15 grams carbs if awake or IV dextrose if it is unconscious. Antibiotics seem simple, but Nclex questions often focus on allergies, toxicity, and educations. Let's talk about penicillins and cephalosporins. Watch for cross allergies. Always ask if the patient is allergic. Monitor for rash, anaphylaxis, severe diarrhea. Aminoglycosides like gentamicin. Risks of nephrotoxicity and ototoxicity. For example, you have to be monitoring boom, creatinine, and hearing. Tetracyclines, like doxycycline, cause photosensitivity and food decoloration. Avoiding children and pregnancy. Don't take with milk or antacid. It's going to reduce absorption. Fluoroquinolones, like ciprofloxacin, it has a high risk of tendon rupture. You have to take or say to the patient that had to report any joint or muscle pain. Microlides, like azithromycin, may cause hepatotoxicity and QT prolongation. Let's review an Nclex tip. You have to teach patients to finish all doses, watch for toxicity, and never ever self-medicate. Finally, the group that confuses most students, psychotropics. It includes antidepressants, antipsychotics, mood stabilizers, anxiolytics. Let's go through it each. Antidepressants, selective serotonin reuptake inhibitor, for example, sertraline or fluoxetine. These medications have high risks of serotonin syndrome, for example, symptoms like fever, rigidity, and confusion. This medication takes 2 to 4 weeks to start working. Monoamino oxidase inhibitors like phenelcine. You have to avoid tyramine foods like aged cheeses and wine and cured meats. This medication has a high risk hypertensive crisis. Tricycles like amitriptyline. This medication can cause orthostatic hypotension and anticholinergic effects. Let's talk about antipsychotics. For example, typical haloperidol. You have the risk of having EPS or neuroleptic malignant syndrome. For example, symptoms like fever, rigidity, and mental changes. Atypical, we have the clozapine and risperidone. You have to monitor white blood cells count due to granulocytosis. Now, let's look forward to the mood stabilizers. For example, lithium. The therapeutic range is from 0.6 to 1.2 milliequivalents per liter. The toxicity signs are tremors, vomiting, confusion, and ataxia. You have to avoid sodium restriction or dehydration. Anxiolytics, for example, benzodiazepines, lorazepam or lorprazolam. These medications can cause sedation and dependence. One Nclex tip is never ever stop abruptly or combine with alcohol. Now, let's make a quick Nclex summary. First, antihypertensives. Always monitor heart rate, blood pressure, and electrolytes. Second, anticoagulants. Watch for bleeding and teach safety. Third, insulins. Know timing, mixing, and hypoglycemia management. Fourth, antibiotics. Recognize allergies, toxicity, and promote adherence. And fifth, psychotropics. Identify life-threatening effects and patient education. These groups are the core of patient safety, and that's exactly what the Nclex focus on. Tell me in the comments which of these 5 drug groups is hardest for you, or each one shows up the most on your Nclex practice text. Save this video to review before your exam, share it with your classmates, and let's help more future nurses join our community. Follow us in our platforms for more Nclex content, summaries, and study strategies. We are on Instagram, TikTok, YouTube, and Facebook as Enfermeras en USA and Nclex con Enfermeras en USA. Let's keep studying together until you pass the Nclex on your first try.